Good evening and welcome to Health Forward, your dedicated program for in-depth discussions on pivotal health issues. Tonight, we delve into a profoundly important question. Should mental health receive the same policy focus and resources as physical health? This topic has gained considerable traction in recent years, reflecting a growing awareness of mental well-being's crucial role in our lives and society. To explore this complex issue, we have two distinguished guests. Mr. Samuel Green, a passionate advocate who will argue in favor of equal policy focus for mental health, and Ms. Olivia Chen, a seasoned public health administrator who will offer her valuable insights into the practicalities, complexities, and potential challenges of implementing such parity. Welcome to you both.
Thank you, Dr. Reed. It's a privilege to be here to discuss such a critical matter. My position is unequivocal. Mental health is not a secondary concern. It is an intrinsic and inseparable component of overall health. As the saying goes, there is no health without mental health. For far too long, mental health has been relegated to the shadows, suffering from systemic neglect. This is evident in the historical underfunding of mental health services, the pervasive stigma that prevents individuals from seeking help, and the glaring lack of access to timely and adequate care compared to what is typically available for physical ailments. Consider the current disparities. Individuals often face lengthy waiting lists for psychological therapies or psychiatric consultations, a situation that would be deemed unacceptable for most physical health conditions. This isn't just an inconvenience. It's a fundamental injustice that exacerbates suffering and diminishes life quality. The socioeconomic impact of untreated or poorly managed mental illness is staggering. On an individual level, it leads to diminished quality of life, increased disability, and, tragically, sometimes loss of life. For society, the costs are equally burdensome. Lost productivity in the workplace, increased strain on other public services such as social care and the justice system, and a significant overall economic burden that impacts national prosperity. Therefore, we must champion policy parity. This means advocating for equitable funding that reflects the true scale of mental health needs. It means ensuring comparable access to a full spectrum of services, from preventative measures and early intervention to timely specialist care for complex conditions. Furthermore, robust anti-discrimination measures must be embedded in policy to protect individuals with mental health conditions in employment, education, and healthcare access. This is fundamentally a matter of human rights and social justice. We must move beyond paying lip service to mental health and enact tangible changes that reflect its true importance.
Thank you, Dr. Reed and Mr. Green, for your passionate opening. I want to begin by unequivocally stating that mental health is, indeed, a vital component of public well-being. There's no dispute that it has been historically underaddressed, and the consequences of this are felt by individuals and communities alike. However, when we discuss achieving, quote, sameness in policy focus, the practicalities become quite complex. What does sameness truly entail? Does it mean identical budget allocations for mental and physical health, irrespective of the differing nature of conditions or treatment pathways? Does it imply identical waiting times for every type of condition, from a common anxiety disorder to a complex cardiac surgery? Direct comparisons are fraught with difficulty because the systems, interventions, and even the very nature of illness manifestation can differ significantly. The resource allocation dilemmas are at the heart of this challenge. Public health budgets, as we all know, are finite. They are subject to immense pressures from various essential services. A significant and rapid shift of resources towards mental health, without a corresponding substantial increase in the overall health budget, could inadvertently impact other critical physical health services. We're talking about areas like infectious disease control, cancer screening and treatment programs, emergency response capabilities, and chronic disease management, all of which are life-saving and essential. Furthermore, we must consider system capacity. Even if we were to dramatically increase funding for mental health overnight, Is the current infrastructure and workforce adequately prepared to absorb and effectively utilize these resources immediately? Are there enough trained psychiatrists, psychologists, mental health nurses, and support workers? Are the facilities and community services robust enough to handle a massively increased demand or service provision? Therefore, instead of striving for a potentially simplistic or even misleading notion of sameness in policy line items, I would propose we focus on achieving equitable outcomes and promoting strategic integration. This means ensuring that individuals with mental health conditions achieve health outcomes comparable to those with physical health conditions through tailored, effective, and efficiently delivered services.
Mr. Green, Ms. Chen has raised important concerns about resource limitations and the definition of sameness. How can we achieve the parity you advocate for without potentially compromising other critical health services, especially if overall health budgets are not substantially increased?
That's a valid concern, Dr. Reed, and Ms. Chen articulates the administrative challenges well. However, the current spending is already imbalanced, disproportionately favoring physical health despite the enormous burden of mental illness. It's not about taking from one to give to another in a zero-sum game, but about reevaluating priorities to reflect true health needs. Crucially, investment in mental health is not just an expense. It's an investment that can yield significant long-term savings in physical health. For instance, untreated depression or anxiety can exacerbate chronic physical conditions like heart disease or diabetes. Addressing mental health proactively can reduce these downstream costs. We should view health spending holistically, as an investment in societal well-being and productivity, which might indeed necessitate an expanded overall health budget to correct historical underinvestment.
Ms. Chen, Mr. Green suggest that investing more in mental health now could yield long-term economic and health benefits, potentially easing the burden on physical health services. From your administrative standpoint, how do you weigh these long-term projections against immediate pressing physical health needs?
Mr. Green's point about long-term benefits is well taken, and in theory, it's a compelling argument. Preventative and early intervention in mental health absolutely has the potential to improve overall health trajectories and reduce costs down the line. However, from an administrative and public finance perspective, the challenge lies in quantifying these future savings with certainty and in a time frame that aligns with budget cycles and immediate public demand. Public health systems are constantly battling acute physical health crises, be it a pandemic, a surge in emergency room visits, or the need for urgent surgical interventions. These demand immediate resources. While we acknowledge the long-term vision, reallocating substantial funds based on projections that might take years or even decades to fully materialize is a difficult proposition when faced with tangible, present-day physical health needs that have clear, measurable, and immediate impacts if unaddressed.
Let's explore the roles of prevention and integration further. Mr. Green, how significant are preventative measures and the integration of mental health services into primary care in achieving better mental health outcomes and potentially addressing some of Ms. Chen's resource concerns?
They are absolutely paramount, Dr. Reed. A reactive system that only addresses acute mental illness is inefficient and inhumane. Investing significantly in preventative measures, starting from mental health education in schools and promoting mentally healthy workplaces, can reduce the incidence and severity of mental health conditions. Furthermore, integrating mental health services seamlessly into primary care settings is crucial. General practitioners are often the first point of contact. Equipping them to identify, manage, or refer mental health concerns effectively can dramatically improve access, reduce stigma, and ensure that conditions are managed before they escalate into crises. This integrated approach is not only more cost-effective in the long run, but also reaches a far greater number of people in a familiar setting.
Ms. Chen, what are the practical challenges and opportunities in scaling up preventative mental health initiatives and integrating mental health services more thoroughly into the existing primary care system from your perspective?
The principles of prevention and integration are certainly ones we support strongly in public health administration. They represent a more proactive and holistic model of care. The opportunities are significant: earlier detection, reduced burden on specialist services, and better overall patient experience. However, the practical challenges in scaling these up are substantial. Firstly, training primary care providers to a consistent and competent level in mental health assessment and management requires considerable investment in education and ongoing professional development. Secondly, developing clear, efficient, and well-resourced referral pathways to specialist care when needed is essential. Otherwise, primary care can become overburdened. Ensuring adequate funding for these integrated models, so they don't just add to the existing workload of primary care without commensurate support, is critical. We also need to address the broader social determinants of mental health: poverty, housing insecurity, discrimination, which preventative services alone cannot fully overcome. So while this is a positive and necessary direction, it requires meticulous strategic planning, sustained investment, and a multi-sectoral approach.
In closing, I want to reiterate a simple but profound truth. Mental health is fundamental to human existence and a healthy society. Our policies, our funding, and our societal attitudes must evolve to reflect this reality, moving beyond historical neglect and disparity. This calls for tangible, decisive actions, truly equitable funding for mental health care, vastly improved access to a comprehensive range of services for everyone, regardless of their location or economic status, and an unwavering societal commitment to dismantling the stigma that surrounds mental illness. The path to parity may present challenges, as Ms. Chen has outlined, but they are not insurmountable. With political will and collective effort, we can create a future where mental health is valued, supported, and treated with the same urgency and compassion as physical health. It's a future our citizens deserve.
I too believe that enhancing mental health support is a critical objective, and it must be pursued within a robust, equitable, and sustainable public health framework. The goal is not to diminish physical health services, but to elevate mental health to its rightful place. While I've highlighted concerns regarding the direct implementation of sameness, my intention is not to resist progress, but to ensure that progress is strategic and effective. We are committed to finding the best ways forward. This means championing evidence-based policies, making strategic investments in areas like prevention and integration, as we've discussed, and continually working to improve system capacity and coordination. It's about intelligent design, not just equal numbers. Ultimately, our shared goal is a healthier society in every respect. By working collaboratively, by understanding the complexities, and by making smart, sustainable choices, we can achieve meaningful improvements in mental well-being for all.
Thank you both, Mr. Samuel Green and Ms. Olivia Chen, for an insightful and thought-provoking discussion. Your distinct perspectives have truly illuminated the nuances of this vital issue. We've heard a compelling case for prioritizing mental health with the same vigor and resources as physical health, rooted in principles of equity and overall well-being. Simultaneously, we've been reminded of the significant practical considerations, resource allocation dilemmas, and systemic complexities involved in translating this ideal into effective public policy. This debate underscores that while the destination, better mental health for all, is clear, the journey requires careful navigation. I encourage our audience to reflect deeply on the points raised tonight and to continue engaging with this crucial conversation. That's all the time we have for Health Forward. Thank you for joining us. Good evening.